A baby born today into an NHS already beyond the imagination of those who set it up. So what future will she face as she goes into her 20s and beyond to her 50s? And then what will her older age bring? What will be cured then that can't be now? In essence, how will the health service help us live, and how will it help us die? When the health service was being set up, who could have predicted just what a different world it would become? From an age when the simplest of infections killed, when life expectancy was below 71, now to an endless list of achievements and technologies and breakthroughs. The heart transplant. Now they do heart, liver, lung transplants. Fertility treatment, babies grown in a test tube, and even basic achievements like cataract surgery, so people who once went blind can now see. If that was the past 70 years, the next 70 years is, those with the visionary goggles say, unbelievably exciting. And that starts even in the GP surgery.
I see a GP surgery of the future being far more technologically enabled than we have now. You'll be checking in, you'll have booked your appointment online or via a smartphone app. When you arrive, you won't be going to a reception desk, you'll be touching in or scanning in, and that's all fine and proper. But then once you get in to see the GP, the one-to-one interaction will be very similar. But it may not be the GP that you're there to see. There are a whole range of other healthcare professionals that it might be that you're there to see. A specialist nurse, a physiotherapist, a mental health therapist, all of whom will be looking after certain elements of your life.
Many believe that we will not be a healthier population. Obesity rates are rising, diabetes is on the increase, lifestyle illnesses will put pressure on the system. And as our baby ages still further, so her risk of cancer will increase. Yet here the future indeed looks bright. This is artificial intelligence, cutting-edge technology at its most beautiful, for developing drugs, reducing side effects, mapping disease. Where the human brain fails, the machine takes over.
The next 70 years, I actually think the next 10, 15 years will be absolutely transformed by these capabilities. We can make predictions through machine learning to predict what are the likely novel, most useful drug targets. We can now be braver and move into novel areas of biology because through our, artificial intelligence and machine learning, we have reduced some of the risk involved in the development of these targets because we've homed in on the ones that are more likely to be successful. The dice, if you like, are loaded more closer to their success.
Genome sequencing, gene testing done in 15 minutes at your bedside. Medicines designed just for you. Beating cancer now sounds like a reality rather than an advertising slogan.
I have literally no doubt. I think we will become better at diagnosing cancers and curing a lot of them. And for the few that we cannot cure, I think they will become manageable through the smart following and adaptation of the therapy to the individual patients.
But if you keep people alive and alive for longer, that has consequences.
Someone over 65 uses around 3 times as much healthcare as someone under 65. But those people over 65 have a lot more health problems now than they used to. They're living with long-term chronic diseases.
And living longer increases the risk of dementia. So as she gets older, our baby will have a 1/3 chance of developing some form of the disease in her lifetime. There have been many false starts on treatments for the most common form, Alzheimer's. But like cancer, researchers are now filled with optimism.
Having effective treatments for dementias, things like Alzheimer's disease, is about understanding what goes on in the brain of somebody with this disease. And it's a really complicated disease. Unpicking those different pathways and then using that knowledge to develop medicines. We're well on the path to that, but we don't have those medicines yet. I hope the first one will be through by 2025, and then in the next 10, 20, 30 years, there'll be a whole suite of different medicines that can treat different types of dementia so that everybody has a much brighter future.
All these breakthroughs and technologies that will, of course, cost money. So the overriding question is, will the NHS remain free at the point of delivery?
What we see whenever you go out and ask members of the public is that actually people do understand across all age groups, across all sections of society, how important that protection that the NHS provides is to them, and support for the principles of a tax-funded, free at the point of use NHS are rock solid in every part of the country, in every generation, across every political party when you poll people.
And we also have to ask, will the NHS have served our baby well as she's grown older, and then as she comes to the end? An end that we can only hope will be as painless and as dignified as possible.